As in a lot of viral illnesses, one of the predominant features can be fatigue. And so besides all the things that we've already discussed, what might be extremely beneficial for people recovering from COVID is some sort of an adaptogen or an adrenal support that can help to repair the body and help to improve energy. One specific one is red ginseng.
Esther Garfin here, and I'd like to welcome you to another Alternative Food Network Doctors Plus episode. This one on what you should be eating and drinking if you're recovering from COVID, which, from what I understand, can be a long and difficult recovery. At the time of this recording, many countries around the world are experiencing a second wave of this coronavirus, and it was very important for me to be able to offer some credible information that could be of assistance to people who are themselves recovering or know someone who is. For this, I'm joined by Dr. Esther Konigsberg. Dr. Konigsberg is an integrative medicine consultant who has been on the show a couple of times already. She's a member of the Canadian College of Family Physicians and a graduate from the fellowship program in integrative medicine at the University of Arizona. Dr. Konigsberg is an assistant clinical professor at the University of Arizona in the integrative medicine program and at McMaster Medical School. She sits on integrative medicine committees in both the U.S. and Canada and has written numerous articles related to optimizing health. Welcome back to the show, Dr. Konigsberg. So nice to have you again.
Oh, thank you so much for having me again. It's a pleasure.
And how are you doing in these challenging times that we find ourselves in right now?
Probably the same as everybody else, doing the best that I can with what I've got. Hunkering down and trying to take care of myself and also work remotely.
Oh, okay, great. So you're doing telehealth then?
Indeed, yeah. That's how I'm continuing with my practice. And it works. And everybody seems to be happy about not having to travel and not having to take the time out of their day to come and see me. So I think it's working very well all the way around.
Oh, that's great. Mm-hmm. Now, for someone who's listening right now and maybe in COVID recovery or a long hauler, which is a term that I've been reading about, I just want to get right into it and not make them wait through a lot of podcast chatters. So generally speaking, what does the body need when fighting infection?
And that's an excellent question, Esther. And I have actually been seeing some of these people who've had COVID and have been having prolonged symptoms. And as you know, they've been joining groups called the long haulers. So, it comes down to a lot of the same basics. To give your body the best chance for recovery, to boost that immune system, to promote healing, it's the same foundations, which is you need rest. You need to listen to your body and rest. And you need good quality sleep and adhering to the sleep hygiene principles, which people can look up because they're readily available, to minimize stress. And ways of doing that, of course, is meditation, to engage back in physical activity to the best of your ability. There's some really good online resources about, if you're having issues with breathing, about doing respiratory exercises or doing a little yoga practice is a great way to begin if you're not ready to re-engage in a little bit more of an aerobic activity. But aerobics, cardio, really important for improving the immune system and recovery too. So it always comes down to self-referral. And of course, we speak about nutrition on this program. So it's about eating very healthfully, whole foods as always, lots and lots of data on fruits and vegetables, increasing immunity, decreasing inflammation. And of course, we really want to bring down the inflammatory response because that often is one of the main underlying phenomena for these long haul issues. So lots of fruits and vegetables, which are rich in a substance called flavonoids, omega-3 fatty acids, which of course we find in things like cold water fish, again, legumes, flax seeds, walnuts. It helps to bring down the inflammatory response, which we really want for reducing pain, for improving our breathing ability. avoiding sugar. Viruses and bacteria love to grow in a sweet environment. So avoiding sugar, avoiding processed foods. So all of those things are really, really important. And it always, again, comes back to self-referral, eating these foods. How does it feel in my body at this time? And listening to those signals always. Eating garlic, just as when we eat garlic, we may not smell so good. I think maybe the bacteria and viruses don't like it either. So, both cooked by garlic is great. There's some really good information about its antimicrobial, so antibacterial and antiviral abilities. The other thing that you could incorporate into your diets, if you haven't yet, is medicinal mushrooms. And what I mean by medicinal mushrooms are the Asian mushrooms, shiitake and maitake mushrooms. They have very potent immune boosting properties, which again can help in the recovery phase if somebody does get COVID. Turmeric, which we find in a lot of curries, that yellow spice, also helps to reduce inflammation. So basically, again, staying away from processed foods, eating whole foods, whole proteins. So again, aiming more towards cold water fish. If you eat meat, more like white chicken, the white parts of turkey, minimizing the saturated fats, which we find in animal fats, such as in meats. And for people, again, who are having respiratory problems, sometimes too much dairy can increase mucus production. So being very aware of that. And if you're going to have dairy, make sure that it's organic. Like Greek yogurt is great. It's high in protein and low in sugars and also very good for the body, but not for everybody, And again, I keep discussing self-referrals. Some people do well with dairy and other people should stay away.
And when you and I spoke before this podcast, you were telling me that you've had different COVID patients present with different symptoms. And so presumably if they're having different symptoms, their recovery is also different. So
Indeed.
Can you give some examples of what you mean by that?
Certainly. As in a lot of viral illnesses, one of the predominant features can be fatigue. And so besides all the things that we've already discussed, what might be extremely beneficial for people recovering from COVID is some sort of an adaptogen or an adrenal support that can help to repair the body and help to improve energy. One specific one is red ginseng, and it has some also anti-inflammatory properties, anti-blood clotting properties, but it does help to support energy and the adrenal system. One of my favorite supplements is by a company called AOR. They make two kinds. One is called Ortho Adapt, and the other one is Ortho Adapt Vegan. And it contains some really wonderful herbs to help support the adrenal system, such as ashwagandha, rhodiola, Panax ginseng, and licorice. Anytime, by the way, that I mention a supplement, I always say that in terms of please consult a healthcare professional, because sometimes these supplements can interact with medications you're on or conditions you may have. So really important to consult with a healthcare professional who understands the role of adaptogens. But I have found that these sorts of things really do help to improve energy in somebody who is recovering, not specifically from a viral illness and specifically from COVID. As we know, COVID tends to have some major effects on the respiratory tract. And so people during the recovery period may notice shortness of breath. They may notice, especially if they have asthma, a worsening of asthma or a chronic cough. And a really wonderful supplement for that is Boswellia. Again, Boswellia does a great job of decreasing the inflammatory substances we call cytokines. And it works really, really well for the lungs. So for people who have asthma, it actually helps to decrease their use of inhalers. It improves respiratory function, but it also helps for people who have arthritis or chronic pain, because again, it's an anti-inflammatory, and it also helps specifically for our guts, our intestines. So for people who are having some inflammation in their intestines, it helps to calm that down. In addition to Boswellia, another really wonderful supplement is NAC, which stands for N-acetylcysteine. And NAC actually helps to not only reduce inflammation, but to help reduce mucus production in the respiratory tract. So that's something else that somebody could use in addition to Boswellia if some of their predominant symptoms are the respiratory problems following COVID. I've had some patients who've talked about some new issues with their digestive systems after COVID that they never had before.
Yes, I was speaking with a friend of mine who lives in New Jersey who was saying the same thing, gastro issues.
Yeah, and it could be different kinds. It could be indigestion. It could be all of a sudden becoming intolerant to foods that you had no problems eating before. It could be diarrhea, bowel pain, and even constipation. So ways of dealing with that from a food point of view is, making sure you have fiber in your diet. Fiber tends to help. It gets broken down in our guts to form the friendly bacteria, which we call the microbiomes. And we really need that friendly bacteria in order to properly digest our foods. So having a lot of fiber in the diet, and again, we're talking about healthy forms of fiber, so whole grains, and of course, fruits and vegetables. So that is very beneficial. And then, as I was mentioning, Boswellia can really help to reduce inflammation, especially for those who've had diarrhea. For people who are having problems with indigestion, sometimes using a good digestive enzyme can help, or even having a little swig of apple cider vinegar and water before a meal can also help break down food better. And by breaking our food down, then it doesn't come back up into our esophagus, so we don't get that reflux or indigestion. And there's also a supplement called diglycerated licorice that helps to bolster the mucus layer of our digestive tract. So it also helps to reduce indigestion. And again, I must repeat, all of this needs to be under the advisement of a knowledgeable healthcare practitioner. It could be an integrative medicine physician, an integrative medicine nurse, or a naturopathic doctor. Those would be, some of the people who may be more aware of these various supplements. And then pain tends to be something that a lot of people notice after COVID. It could be joint pain, it could be muscle pain, different things we can do. I've already mentioned the role of exercise and the role of yoga, which is wonderful for stretching the muscles and bringing blood flow to the muscles. For people who are noticing muscle cramps, taking a magnesium supplement can be very helpful. One has to be very careful with the magnesium you choose, because some magnesium compounds like magnesium citrate can increase diarrhea, and if you're having issues with that, you don't want that. So a magnesium bisglycinate often is really good for not creating any problems with the gut. And magnesium also helps not just to relax the muscles, it helps to relax the mind, and it's fabulous for sleep as well. Turmeric, we were discussing before, is a wonderful anti-inflammatory that could also help to reduce inflammation and pain. And we mentioned the omega-3 fatty acids that we can find in fish, but to really have it work on a medicinal level, you could also use it in a supplement form so that you can get a much higher dosage of the components of omega-3s that are important, which are EPA and DHA.
One last question before we go, and this relates to vitamin D. Towards the beginning of COVID, you and I recorded an episode of Doctors Plus where we discussed foods and some supplements that boost the immune system in general, and also if a person has contracted COVID. So At that time, we discussed vitamin D, and you mentioned that while generally speaking, it's a very good idea to take it, it could increase an inflammatory response, so that with the onset of COVID symptoms, it would be prudent to stop taking vitamin D. Now, that
Yes.
conversation was over a half a year ago, and since then I've heard quite a bit about vitamin D. So I'm wondering if you have a different recommendation now when it comes to taking vitamin D once a person has contracted COVID.
Esther, you're exactly right. Early on when we spoke, and I can't remember, it must have been like April or such, there were some concerns. At that time, I think I was stressing that it was theoretical concerns that if you took vitamin D after getting COVID, that we were concerned that there was a potential for a worsening inflammatory response, which we did not want to have because that could create more illness. However, since then, there have been a lot of studies that have been done, most of them observational, and one actually I'm going to point out, which was using vitamin D in the hospital setting. So in terms of observational, what they have noticed is that more hospitalized patients have a deficiency of vitamin D than people who've gotten COVID in the community and never needed hospitalization. So it appears that people who do not have enough vitamin D in their bodies and their bloodstream have a poor response to COVID. They get more ill. The other thing they noticed is that for patients who had been hospitalized, those with sufficient levels of vitamin D are less likely to be admitted to the ICU rather than those who had insufficient levels of vitamin D. And finally, they used vitamin D in the hospital setting. And for the patients who were treated with vitamin D, only 2% got bad enough that they needed an ICU admission, whereas people who were not treated with vitamin D, 50% of them ended up in the ICU, and a much smaller percentage of them passed away. And that was with usual care. So it was in addition to the usual care that was being given to both sets of patients. So in that setting where we're dealing with people who are rather ill because they've already been hospitalized, making sure that they have sufficient amounts of vitamin D and supplementing those amounts seems to be protective. So the theoretical concern did not bear fruit. And certainly taking vitamin D would be prudent, and continuing to take it if you get COVID would be prudent as well. One thing that I do for my patients is I get their vitamin D levels, because there are so many variables about why we may be sufficient or not with vitamin D, and then that can then give me the opportunity to be more targeted in how much vitamin D an individual should be taking.
Oh, so do you do that with all your COVID patients? You get their vitamin D levels tested, or is that actually part of a routine blood work for everyone?
For the kind of patients that I see, I do that routinely for everyone. And certainly, considering we're in the middle of a pandemic, it makes sense right now to do it for everyone.
And then you test their level, you get their levels tested.
And based on that, I'll decide how much. If I don't get their levels, then I usually suggest at least 2,000 international units, but it is not unusual for me to suggest 5, 6, 7, 8,000 international units, again, based on somebody's levels. And also about 3 months later, I will retest just to see where things are at to further guide vitamin D supplementation. A lot of us think that in the summer we don't need as much vitamin D, but we forget that a lot of us wear sunscreen, and sunscreen blocks the production of vitamin D.
Okay, well, this was excellent information and an excellent tip on the vitamin D and getting levels tested. If someone would like to get in touch with you, how can they find you?
I'm online, so my practice is called Integrative Medicine Consultants Incorporated, And I'm affiliated with the Interdisciplinary Health Clinic in Toronto. And the best way to make an appointment is to call that clinic at 416-598-4999.
Okay. And is there a website that people can go to?
Yes, it's integrativemedicineInc.com is my website. There are many of us who have graduated integrative medicine fellowships, both in Canada and in the United States. And one could go to the Andrew Weil Center for Integrative Medicine, where they have graduated well over 1,000 physicians, nurse practitioners, physician's assistants, pharmacists, and one can find graduates in your area who would be, I'm sure, happy to see you as well, or see you remotely.
Yes. All right. Well, thank you so much. I hope this will really help people who are struggling during their recovery, and hopefully it will expedite their recovery as well. So we really appreciate your time today. Hopefully the next time we speak, it will be under better circumstances for everybody.
Indeed.
I hope you found this podcast informative. To keep up with all of the latest content from Alternative Food Network, please be sure to sign up for our newsletter at alternativefoodnetwork.com and follow us on social at Alternative Food Network. And if you like this episode, please share it with others. Until next time, thanks again for listening and be well. All content provided or opinions expressed in this podcast are for informational purposes only and are not a substitute for professional medical advice. Please seek advice from a qualified healthcare practitioner.